You can go ahead and clear it up. What does Ronald McDonald House do?
Absolutely. You know, that's a good point. We see that all the time where families show up at our doorstep or we're out speaking, and you know, a lot of people have heard of the Ronald McDonald House but don't know what it is that we do. So what we kind of coin ourselves on is we're a home away from home for those families. And what that means is these families have a sick child, they're in the hospital for one reason or another, they're far from home, it could be 30 minutes, could be hours, or could be states away, and we just try to provide everything they would need if they were in their own home. So that whether that's laundry services, whether that's food, whether that's a place to sleep, or a combination of all those.
How exactly do you guys work? Now, let's say, you know, I have a child that's over in the hospital. How do I get involved in the Ronald McDonald House? How do I?
More cases than not, what happens is the social workers at the hospitals make a referral. So they'll come talk to your family, and they'll say, you know, did you know there's this place called the Ronald McDonald House? This is what they do. So they've got a little bit of information. That social worker then gets with our staff, gets with our house manager, and says, hey, we've got this family that we think could benefit. Somewhere in that process, depending on the child's health, sometimes it's an hour later, sometimes it's, you know, whenever the family can get to it. They make contact here, they come here, they go through a little bit of an orientation, and we show them around, and if we've got a room available, which hopefully we do, we get them checked in.
Okay. How long can a family stay here?
Family can stay here as long as they need to. As long as they have a child receiving medical treatment is what our definition is. So if that child needs treatment for a day, you're here a day. If that child requires treatment for months, we've had families stay as long as 18 months here at this house.
Really?
Yeah.
How was that experience? Did they enjoy it?
They did enjoy it. In fact, that's one example, but we've had other examples where people have actually even relocated to Toledo because the medical treatment is going to be ongoing for long enough that mom and dad find jobs here in Toledo and relocate. That doesn't happen a lot, but on some occasions we see that happens. Again, if my child's sick and this is where they need to be, I'm going to do everything I can be. And we've helped make that transition for families that have moved into the area as well.
Okay. Last time I was here, you spoke to me about a Halloween type deal. What do you guys do with the kids? What other types of things do you guys do in the community? Or?
You know, we're not extremely active as far as, you know, you're not going to see us every month doing something. We do the Oktoberfest in October, and that revolves around our Pop Tab collection.
Okay.
And we can talk a little bit more about that, but the Pop Tab collection is something that we just try to raise awareness to people that we collect Pop Tabs, why we collect Pop Tabs. So it's a good day that we hold at Home Depot, and Home Depot does a nice job of hosting that for us and allows us the space. But the idea of the event is obviously to collect Pop Tabs because we do recycle those to use those for food as well as other needs if need be for families. But basically that 100% of that donation goes directly to those families. And because we're a house that collects anywhere from 50 to 60 million Pop Tabs a year, that's a significant piece to us. But there's a lot of people in the community that aren't collecting or that don't understand why we do, so it's a good day for us to get that awareness out.
Right.
So that's one reason, or one event that we do, and the reason that we do it. We do a spring cleanup. We have a big house here. We have 14 families living with us at a time. So it's a good time for organizations to close their doors for the day, come on out here and help us clean up the house. We usually have some fun things going on at the same time. But it's just a good day for us to spring clean, and we do that every spring.
Okay. Did you want to go a little bit further into the Pop Tab collection?
Sure. Absolutely. The Pop Tab collection, I usually like to head it off at the beginning when I discuss this, because there's always people that say, well, why do you collect the tab and not the can? And that's probably one of the biggest questions that we get. Two big reasons we don't do the cans is, again, like I said, we collect somewhere between 50 and 60 million Pop Tabs. If we collected 50 or 60 million Pop cans, it would be an enormous feat. That's probably the number one reason. The number two reason, though, is there's other organizations that collect pop cans, and we didn't want to be the organization that says, stop giving to this organization, start giving to us. We saw this as a nice way to share and give to two organizations at the same time. We love the program because it does provide to the families. 100% of that donation goes to the food. And actually, in the last couple of years, we've collected more pop cans than we needed for food money, so now we've started chipping away at the utility costs and things like that. But we want that 100% of those Pop Tab revenues to go towards the families. There's no admin cost at all in those, and we're very proud of that. But we also like the Pop Tab program because it's great awareness. It's a good way for the community to think about us every single day. You know, you drink your can of pop and take that tab off, you're thinking of us. So we really enjoy that ability to not only put 100% of it towards the families, but also the piece that we can make it a great awareness tool.
Okay. How can the community get involved with the Ronald McDonald House?
What I like to recommend to groups when they first get involved with us is, you know, come and tour the house. Come in, see what we're all about, see what sparks your interest. Because a lot of times people come through and they say, hey, I'd like to cook a dinner, a meal for the families, which is a great program, or what we call our Dinner on the House program. And we have better than 200 or 250 groups that come in and cook dinner for the families that are staying here. The best part about that program is, A, it's very tangible. People can come in, they can cook food, and they know that they're providing it to people that have had long, long days over there at the hospital.
Right.
What a nice piece when we see the evaluations from the families that check out. That's always at the top of their list of the things they loved, was the fact that they came back at 7 o'clock, 8 o'clock, 10 o'clock at night, and dinner was already prepared. Our goal is to have 365 days where that dinner is prepared for those families, as well as additional meals. It would be great if we had breakfast, lunch, and dinner provided. So it's a great way for people to get involved. But again, when we bring people into tour, sometimes they see something that we hadn't thought of, and they say, boy, I could really get involved because my time and talents, I can provide this. And we like to welcome that as much as we can.
Okay. I know she was telling me, excuse me, she was telling me some different things that are on the website. Where can people can go to the website, there's a wish list where
Yep, we try to maintain that wish list as accurately as we can, and I would say we do a pretty good job. And what we try to do is say, hey, what are the needs in the house? What are the things that we need, whether it be sandwich bags or whether it be cans of tuna or whatever it is, and we try to maintain that to let the community know. If you can provide the things that you see on our website, on our wish list, that would be a tremendous help to the families here.
Just fundraisers that we do at the Ronald McDonald House of Northwest Ohio is our pull tab collections. We supply our pantries with the pop tabs that our families collect and that we collect throughout the entire community. Last year alone, we did over $19,000 in recycled aluminum. It does provide 100% of our food budget. It feeds the families of things that aren't donated. The perishable items, milk, ketchup, mustard, hamburger. So that is how we supply hamburger, cereal, and things that our families use. The TV dinners, frozen pot pies, frozen pizzas, so that we keep our families fed and they never have to worry about spending money in hospital cafeterias. The person who developed the Ronald McDonald House was a football player by the name of Fred Hill, and at the time he had a 3-year-old daughter that had leukemia. And when he was traveling around for his treatment, he felt like he was the only parent around that had a sick child. And he said you'd walk through the hospital aisles and you would see these children in their rooms with their parents, and then you'd see the parents in the cafeterias, but you didn't feel you could infringe on their rights and walk up to them. So when he got back to Philadelphia, because he was a football player for Philadelphia Eagles, he was talking to his general manager and to the oncologist there, and he said there ought to be a place where when a parent has a child in the hospital that they can go to get away. They can get away from eating hospital food, get away from eating out of the vending machines, get away from staying in sterile hotel environments. The whole concept was to make this a home away from home. And that's how we started, is a home away from home. So everybody shares TVs. We don't put televisions in the bedrooms. It just gives everybody a common bond. This house is 50% newborn intensive care, and that means the rest of our families are pediatric patients. So everyone's here for a little different reason, whether it be cystic fibrosis cleanouts, which are long-term, treatments, or a lot of trauma accidents where they life flight patients in. But every parent has one thing in common: they have a sick child. And because of that sick child, they're staying here at the Ronald McDonald House, and it gives them something to bond over. They can talk to it. 50% of the newborn intensive care patients, when they're here, mom and dads, some of them are here 2-3 months. Well, when someone new comes in, they can talk to another parent that's been doing something. They'll say, oh, they're going to do this treatment on my child tomorrow. They're going to do a pneumogram. Well, it's a big, long word. But when you talk to another parent that says, they did that last week, this is what's going to happen, it takes the pressure. It's one thing for a doctor and nurse to explain a procedure to a parent. It's another thing to go parent to parent. So the peer support is probably the #1 thing here at the Ronald McDonald House. One of my favorite stories here is we had 2 families staying here at the Ronald McDonald House. One had a daughter with a real debilitating disease that she sees a doctor over at the medical college with, and they were here at they fly in from Philadelphia, and because of that they're here probably 2-3 extra days because of flight schedules. And they were talking to another parent here in the kitchen who had a daughter in one of the treatment centers here locally, and they were from the Detroit area, and her daughter had been in and out of treatment centers for off and on for the last 4 years. Well, the parents were talking to each other, and the daughter that was in the treatment center here in Toledo was in a psychiatric unit. And the parents that were here having their daughter treated, when they started discussing just having a heart-to-heart conversation with each other, their daughter had also been in psychiatric treatment centers. And they found out that what happens is with this one real rare disease that children, teenagers get, most of them are put in psychiatric centers first. And they were comparing notes, and the mother who had the daughter in the psychiatric centers kept saying, but that's my child. Everything you're telling me your daughter has, that's my child. And she went over to the psychiatric treatment center, talked to the doctors over there. They did one test on her daughter, and she was diagnosed with the same disease. She has not been in the psychiatric center now for 3 years. And that's one of my favorite stories about here at the house. I mean, this is where our families bond together. This is what they, again, can they discuss. They can have peer-to-peer relationships that takes a little bit of the tension off. And